Good morning, everybody. A great pleasure to be here, but my apologize for all of the audience because my presentation are in Spanish. And this is a big or little big problem. We have in the Congress a big delegation from Latin America. We have the equivalent of 12 different countries for Latin America, and we decided in the group has the presence of the Spanish experience in the conference. My presentation, how many people understand Spanish? One or two or three. Well, sorry for all of the groups. My presentation is the idea is present the development of the National University of Puerto Rico national program of health promoting university in the government state University of Puerto Rico. This is the acknowledgement for all of the groups. The next. Thanks to the University of British Columbia for receiving in this week. Thank you. Another thanks to the city. Bueno, the University of Puerto Rico is the government university, is the principal university of Puerto Rico. At the present, we have 5,054 academic personal resources professor. We have 61,967 estudiantes. The University of Puerto Rico has 11 campuses around the island of Puerto Rico. Each of campuses including particular disciplines, specialization, etc., etc., etc. And our health promoting university are a decentralization proposal, and in all of 12 campuses we have a particular and idiosyncratic healthy university program. Next. Next. We are part of the Inter-American, Ibero-American network of health promoting university. At the present moment, the coordination office, the headquarters of the Inter-American, Ibero-American network are in the University of Puerto Rico. One of the particular concepts of our healthy university program in the island is the definition of the health promoting university. One of the conceptual aspect in our region is that the many program of healthy university in different countries focalizing only in preventive services directly to the students. And we, during the 5 last year, we have a new definition of health promoting university for the inclusion of 10 different activities of the movement of health promotion universities. Definitely, one of the points of the definition is the political commitment of the universities, no? In terms of fostering the project of healthy university. But in our definition, we have 10 different operational approaches to the movement of health promotion in university. First, todo lo relativo a policy, institutional policies, normative. The second one is the health education action, health literacy. We differentiate the health education action with health literacy. In our case, in Puerto Rico, we use the approach of critical health literacy. It's more más cercano, más with the approach of health, social determinant of health. So the health literacy in the context of the University of Puerto Rico health promoting movement are in the area of health determinant. And the third point is the approach of health communication. The third component is obviously the service, health services in general, in health promotion in general, in preventive services, and in the area of the approach of social determinant of health. The next. The fourth point is the activities of the area of training in the development of training activities in the area of health promotion, health education, and the propious movement of health promoting university. In other ways, in terms of training at a specialization grade, academic grade, or transversalization initiatives at the interior of the university. Another point is the participation in different activities related to the leadership, student leadership, advocacy, and the concept of habilidades para la vida is the concept of the World Health Organization. ¿Cómo se dice en inglés? Life skills, definitely life skill. Do you know that the World Health Organization has a particular approach related to the health skill, including 10 health skill development curriculum, and we use this instrument in the process of health promoting university. The development of association, partnership, and network at the national levels, and the vinculation with the communities and with the vinculation with the international communities. The seventh point, the next, is all of the university action related to the re-engineering, related to the physical environment, all of the activities related to the recreational, etc., etc., etc. The eighth point is the research and evaluation activities related to the activities of health promoting university, related to the lifestyle of health lifestyle of the student, etc., etc. The ninth point is all of the activities with a particular attention to the families or external community to the university. It's part of our approach in our model of health promoting university. And the 10th point is another institutional opportunities, ¿verdad? Or social opportunity of vinculation with the external community, with the government authorities, with the NGOs, etc., 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 in different initiatives related to the health promotion movement at the national countries. This is the main approach. Thanks. Well, our conceptual framework in the project of Health Promoting University of Puerto Rico, using these four conceptual framework. The first is the conceptual of health promotion in general. The second one is the setting approach of health promotion. The third one is the all of the social responsibility of the university in terms of the higher education institution. And the third one is the network, a philosophy of work, the network experience in health promotion in general. Next. 2 years ago, we celebrate the 6th National Conference and International Conference of Health Promotion University in Puerto Rico, and one of the products of this conference is establish a new declaration about the health promotion university at the region. And we have a document in Spanish said 10 para la década en el movimiento de universidades promotoras de la salud. These documents are in Spanish and English, and I suppose that it's included in the material, electronic material of this conference. Our declaration in the Ibero-American region at this moment. Establish in terms of content, establish the social and political responsibility of all of the universities in terms of promote the health promotion movement, not only at the academic setting, and including the social and political responsibility to elevate the health promotion movement at the social and political arena. Is a particular declaration because it's very political. It's not only the responsibility to the university, is the opportunity that the university defend, advocate the movement of health promotion at the external community. Next. Well, this is the different statement of the declaration, but we don't have time for continuing. Another. All of the declaration, all of the declaration is part of the political commitment of the university in relation with the health promotion. This is the different point of the declaration. The second. Another. Sí, continue, please. Sí, the next one, because we don't have time. The next. Well, this is the last meeting of the network of health promotion university in 2013 in San Juan de Puerto Rico, 2 years ago, and we celebrate in this moment the 10 years of the establishment of the Inter-American Network of Promotion Universities. Continue. This book is one of the projects of the network. The book the content of the books is all of the development of the movement of the health promotion university in all of the region, and we have in the content of the books we have the experience of the 14 national program of health promotion in the region. We have in Amazon.com. Another.
Is it in English as well, the book?
It's only in Spanish. It's only in Spanish, but contain all of the declaration at the region in the 10 years of history. The next one. Well, we have in the region a particular protocol to establish the program of health promotion university. In general, at the global level, my thing is all of the protocol model or planning model maintain a regular and similar basis to establish the project of health promotion university. Continue. All of these are part of our protocol for establishment the health promotion university. This is another planning model at the global level, right? Who is the Mark Doris model, and maintain the same point that our particular model. the institutional compromiso, ¿verdad? The designation of the coordinating committee of the university, the situational analysis, the designation of particular group of work, action, evaluation, and continue the inputs. In the case of the University of Puerto Rico, we have the particular model. In our case, it's the compromise, the political voluntary of the presidency of the university. We have two committees. One of the systemic committee for the 11 campuses of the University of Puerto Rico. We have an executive committee of the office of the president of the university. This is the singular point. Our coordinating committee are allocated in the presidential of the University of Puerto Rico, and this is the difference because we have all of the support in terms of the operational basis. Next. At the present, we have all of the support of the University of Puerto Rico, a very participative movement in all of the campuses. We have a work plan, evaluate every 2 months. We have a particular meeting with the committee, and every year we have a particular Congress of Health Promoting University. The next.
Do you have a slide you'd like me to jump to? Just I want to allow questions before the end of the
Okay. Okay. This is the acknowledgement of the groups, and if any question, because we don't have more time, and I respect the.
So just a question, when you said you had meetings every 2 months, is that with the full broad group or just at your campus?
We have one executive committee, the equivalent of executive committee, at the office of the presidency, and we meet every 2 months for evaluate the progress of all of the university program, both in any campuses has another internal health promoting committee for the operational basis of the project. Yes.
And the charter was for all the universities?
Yes.
Is it Charles also using other Latin American countries, or is it especially for Puerto Rico?
This model is especially for Puerto Rico. This evening, I intend to talk about the experience of all of the region, because we have many models in the different countries of Latin America. For example, in the case of Colombia, I appreciate the model of Colombia. Colombia has an excellent structure of health promoting university, combining the participation of public and private university, and in the government body of the National Colombian Network of Health Promoting University, establish 50% of participation of public and 50% participation of the private university, and in this model of Colombia, he has divided the countries in different geographical regions and established a mini network in any of the region, promoting the decentralization and promoting the particular attention to the directly needs of this region. This is a particular model. In the case, very briefly, in the case of Mexico, is another approach. In the case of Mexico, maintain the relationship, very directly relationship with the government authorities, with the health sector, and is a relation of the universities and government, and all of the work plan, national work plan, articulate the priorities of the Division of Health Promotion of the government of Mexico with the particular interest of the Mexican network of health promoting universities. It's a combination of government and university action work.
Thank you so much.
Thank you.